Hi, I'm Phoebe McDowell, Acting Beauty Director at the Sunday Times Style, and I'm joined here today by Dr Emma Wedgeworth, Consultant Dermatologist, and we are going to be talking all things Botox. So, talk us through what Botox actually does and how it works.
So Botox is actually a trade name for a group of injections which relax muscles, and they've become incredibly popular in treating some of the signs of aging, because within our face we have lines which develop which we call dynamic lines, and that's because of our repeated facial movement. And actually, if we use muscle relaxing injections like Botox, we can actually soften those lines. I mean, there will be some people out there that don't want to have anything injected into their face. Lines and wrinkles are normal. It's absolutely fine to just use creams or just protect your skin. But if you're bothered by certain facial lines, Botox can be a very effective treatment for that.
And what age should you start getting it?
That really depends on your individual facial movement. So for some people, they're very expressive, and they may find that to prevent lines from getting much deeper, they may need to go for these sorts of injections earlier on. For other people, lines and wrinkles actually develop much later. So it really does depend on your own face and the way that your skin has aged over time.
So you talk about prevention. Is preventative Botox, also known as baby Botox, a thing?
Yes, it is. So fundamentally, muscle relaxing injections like Botox just stop you from moving your face quite as strongly. They don't actually totally get rid of lines. So if you end up having Botox very late on in your 50s or 60s, you may find that your lines are already too deep for Botox to really soften them. And so actually starting a little bit earlier can prevent those lines from developing. But it's not for everyone.
And can I ask, do you get it yourself?
I do. I've had it for about the last 9 or 10 years.
So what's the process? What happens?
It really depends on which areas you're having it in. The most popular areas that we tend to do Botox in are the frown lines, the glabella, and the forehead, where we lift our eyebrows, and then also often around the crow's feet in that sort of zone. And when we administer Botox injections, what we'll do is we'll dot them around in different areas within the face to try and maximize the effect, but minimize any sort of side effects. And it takes about 5 days for those sorts of injections to kick in.
So when will you start to see the full effects?
So at about 7 days, you'll really start to see the effect of Botox kick in. And often what we'll do is we'll get people back after about 2 weeks to see how the Botox is taken, to see whether they might need a little bit more. Because the great thing about Botox is the very small doses can actually be very, very subtle, and you can always put a little bit more in if you need to.
And does it hurt?
So it is an injection into the face. It can be slightly uncomfortable. It can have side effects. It can cause some bruising and some swelling. It's not for everyone.
And what should people be mindful of if they're looking to get Botox?
So Botox is actually a medicine, and I think it's really important that it is administered by people who have a lot of experience in the medical field. It's so easy to get Botox now, right? You can go to parties, you can get it all on the high street, but actually it's really important to go to someone who knows what they're doing and can minimize the chances of side effects, but also deal with any complications if they do happen. You can't have it if you're pregnant, if you're breastfeeding, and there are certain medical conditions which mean that we wouldn't do Botox.
And are there any other uses for Botox?
Botox is used really widely in medicine. So in dermatology, we can use it for excessive sweating. We'll use it under the arms, and it can work really, really well. And then in other spheres of medicine, it can be used for headaches, it can be used for eyelid spasms, for muscular spasms. And I think that means that it's actually quite reassuring. It's widely used, and so actually we know quite a bit about the safety of Botox.
So we hope that answers any questions that you had about Botox. Thank you so much for watching this episode of Dear Dermatologist. Don't forget to subscribe to the Sunday Times Beauty YouTube channel, and we'll see you again next week.